Hello and good afternoon, and welcome to the session on the topic Heavy Menstrual Bleeding Causes and Management Options by our expert Dr. Divyambikai, consultant obstetrician and gynecologist at Apollo Cradles and Children Hospital, Chennai. Considering the cruciality of the topic, we would like you to pay attention and stay tuned for all the important details the doctor has to share during the session. So stay tuned. If you have any queries, any doubts, post that on the comment section. Our doctor will take all your questions by the last of the session. So stay tuned. And doctor, you have the stage now.
Thank you. Good morning, all. So, I'm Dr. Divyambige, consultant obstetrician gynecologist, fertility specialist from Apollo Cradle, Karapakam. Today, my topic of discussion would be on heavy menstrual bleeding. What are its causes and what are the treatment options for them? So, to start with the topic, I would like to explain about the normal menstrual cycle so that we'll all know what is abnormal and when to consult the doctor. So, normal menstrual cycle, the frequency expected is somewhere between 21 to 35 days once if the period happens. Then we consider it as regular periods or regular cycles. And about the duration, anything between 5 to 7 days of bleeding is considered as normal duration. An elderly woman, it can vary, like it can be 2 to 3 days also, but anything less than 7 days is considered as normal duration of periods. And regarding the flow alone is always a subjective thing. So, how we identify whether the flow is heavy or not? So that is the discussion topic today: heavy menstrual bleeding. So when do you have to consider that it is a heavy bleeding? Is that regarding flow? If there is any clot passage in the menstrual bleeding, then it could be a heavy menstrual bleeding, or sometimes prolonged bleeding, more than 7 days of periods flow is again like abnormal bleeding where you need to consult your doctor. And once with these symptoms like passage of clots in the periods flow and prolonged, you have to consult a doctor where we will advise the common test to evaluate the reasons behind them. So the first and foremost thing, once you present to the doctor with these symptoms, we try to assess your hemoglobin. So that indirectly tells how much blood you have lost during the period cycle. So hemoglobin we assess through complete blood count. So the main concern about this heavy menstrual bleeding is actually drop in the hemoglobin, leading to further other complications because of anemia. So normally these heavy menstrual bleeding may or may not with pain, may or may not associated with pain. So if the flow is associated with pain, then women are like more concerned and they approach the doctor very soon. But some women they experience heavy flow alone without pain. So painless heavy flow is the thing. It's more concerning because they don't come to the doctors early and they present to us, hemoglobin would have dropped to very low levels, like they present with very severe anemia. I've seen people with hemoglobin of 4 or 5 grams coming to the consultation for the first time for heavy periods. So that should not happen. So my main intention of this talk is like to create awareness about anemia related to this heavy menstrual bleeding and to prevent anemia also in women. So this the main concern is in anemia. It affects the general overall well-being of the women. So common symptoms associated with anemia are easy fatigability, that is feeling tired all the time, not able to do any routine activities itself, and breathlessness, feeling difficulty in breathing or feeling exhausted even for a normal activity like climbing one flight of staircase or doing any other routine activity, walking for 10 minutes itself, they feel more breathless and they won't be able to perform any routine activities. And other symptoms are like hair loss and loss of appetite, all those things are the symptoms of anemia. And in long run, people who have not corrected their anemia, in the long run, they can end up with some cardiac complications. That is that low hemoglobin for a longer time can affect the heart also. So that is why it has to be identified and treated at the appropriate time. So first, we'll check the hemoglobin, and it is indirectly gives a objective way of assessing the blood loss during periods. So here, after this hemoglobin test, we do other certain hormone tests, which could be the reason for this heavy bleeding. Common as the thyroid hormones. So we do this thyroid function test in empty stomach. So the blood sample has to be given in empty stomach. And already a known thyroid patient, already known to have hypothyroidism or hyperthyroidism, they are after checking the hormone levels, we adjust their thyroid dose accordingly to control the heavy menstrual bleeding. And other tests done are ultrasound scan. Ultrasound scan is done to assess any abnormalities in the uterus or in the ovaries. So any lumps in the uterus, common lumps found are fibroids. Fibroids are benign lumps seen in the uterus. Mainly the location of fibroid is what is important, because sometimes fibroids seen in the inner wall of the uterus, we call it as submucous fibroids. These fibroids are very notorious to cause heavy flow during periods, resulting in severe anemia. So, submucous fibroid is a variety of fibroid which causes heavy menstrual bleeding. And other reasons could be polyps, endometrial polyps or cervical polyps. Polyps are fleshy growth in the womb or uterus. So all these things can be identified through scan. And in the as well as in the ovaries also, any functional cyst of the ovaries, and sometimes PCOS women also may experience heavy menstrual bleeding because of their irregularity in the cycles. And they are always associated with a condition called they may be associated with a condition called endometrial thickness. So thickened endometrium. So whenever the endometrium is the inner lining of the uterus. So whenever the thickness of the inner lining increases because of irregularity in the periods, these women are prone for heavy menstrual bleeding and prolonged bleeding also, more than 7 days of menstrual bleeding. So all these things are assessed through scan. And then as well as the examination part, where we'll do a internal examination per speculum to check for any ulcers or any lumps or growth in the cervix. Cervix is the mouth of the uterus. As well as we do perform this pap smear test in all married women. So that is a cervical cancer screening test, as well as we get information about any inflammation, infection in the cervix, that is the mouth of the uterus. So after doing the examination on all these investigations, and one more thing, in the history also we would be asking about any underlying health conditions, especially women in the late 40s. If they are having any underlying heart disease or any other issues for which they are on blood thinners. Sometimes people on anticoagulation therapy. This is main purpose of the therapy is to prevent the clot formation in the body. So as a side effect of those medicines also, they may tend to bleed more. So all these things will be noted in their history. And girls in a much younger age group, like immediately after menarche also, they may experience heavy menstrual bleeding. In those young girls, the reasons could be sometimes a clotting disorder, coagulation disorder. So all these things will be noted down in the history, as well as in the investigations also we do perform these coagulation disorder screening test in younger age group women. And after the thorough evaluation, and then we proceed with the treatment options. So treatment manager option is directed towards the cause behind the heavy menstrual bleeding. So we go by age group wise. So starting with the teenagers, that is immediately after the puberty they are experiencing. The common reasons could be this clotting factor disorders, all of those. If anything is found, any of those disorders are found, then we'll be treating accordingly. Sometimes everything may be normal. It's just a pubertal menorrhagia, where pubertal menorrhagia is heavy bleeding immediately after the periods, immediately after the onset of first periods. So in those conditions, the young girls will be given non-hormonal medications. So for this heavy menstrual bleeding, we have hormonal as well as non-hormonal medications. For teenagers, we prefer to start, the first line of treatment would be with non-hormonal. We don't prefer to use hormones as the first line, so we use non-hormonal medication. So the common medicines used are this non-steroidal anti-inflammatory drugs. where it will be helpful in reducing the blood flow, as well as it has another advantage of giving pain relief. So young girls with heavy flow, painful heavy flow during periods, these group of drugs can be administered safely to control their symptoms. The second medication is tranexamic acid, another medicine which is again a non-hormonal pill, which can be safely used in this young girls for controlling the blood loss. So in this heavy menstrual bleeding, we have to concentrate on two things. One is to control the ongoing blood loss, as well as we have to improve the hemoglobin, which was lost, which was like affected because of this heavy menstrual bleeding. Both should be concentrated and treated simultaneously, so that the general well-being of the patient is taken care. So apart from these medication, the young girls will be supplemented with iron supplements. So iron supplements, based on their hemoglobin value, we decide the duration of iron therapy. So anything around 10 grams is mild anemia, 7 grams to 10 grams is moderate anemia, less than 7 grams is severe anemia. In some cases with severe anemia, we may have to give blood transfusion also. So the take-home message from this talk would be like, people with heavy menstrual bleeding should not end up in such critical stage where they require a blood transfusion. They should come up with the symptoms and take a the gynecologist opinion at the earliest to prevent any complications because of this heavy menstrual bleeding. And now moving on to the next set of age group, that is the reproductive age group women, where such heavy menstrual bleeding, they may be associated with some problems in the uterus also, because these fibroids, polyps, all these conditions are very common in the reproductive age group between 20 years to 40 years. So through this scan, we'll be coming to know if there are any issues like that, and the treatment will be directed accordingly. Like for example, if suppose a polyp is identified, the fleshy growth in the inner wall of the uterus, that is endometrial polyp. If suppose a diagnosis of endometrial polyp is made, then we would be planning for polyp excision or polypectomy through a hysteroscopic guidance. So in this procedure, this is actually a surgical procedure where hysteroscope is a telescope with light attached, where we pass it via the lower part of the uterus, via the cervix, to see the inner wall of the uterus or the womb, and we'll exactly localize where the polyp is, and then we go and cut the polyp base and we excise the fleshy growth and we'll send it for biopsy. So this is about hysteroscopic guided polypectomy for endometrial polyp. And the next condition could be fibroids. Fibroids are lumps, benign lumps. The position of fibroid could be varying. It can be in the inner wall of the uterus, or within the wall of the uterus, or on the outer wall of the uterus. Based on the location and size of fibroid, and how much symptoms it is causing, like how much a drop in the hemoglobin is associated with this fibroid, all of those will be considered before planning for surgery. If it is a very small fibroid, then we can try with medical management. If it is a big size fibroid causing excessive bleeding with severe anemia, then decision for surgery will be made. And regarding the surgical technique, based on the age group of the woman and their desire for fertility, the surgery will be performed. In younger age group women who have not completed their family and they want to plan pregnancies in the future, only the excision of fibroid will be performed. The name of the surgery is myomectomy, where only the lump is removed and the uterus is retained. So, based on the location also, if suppose it is in the inner wall, it will try to remove it via the hysteroscopic resection. And if it is in the between the walls of the uterus or outer wall, then a laparoscopic surgery or an open technique will be performed to remove only the fibroids. So this is about the management of fibroids causing heavy menstrual bleeding and anemia in women. And other causes like if at all any cervical polyps, cervical erosion, all those things will be treated accordingly. And in PCOS women with heavy menstrual bleeding, with thickened endometrium, mostly they'll settle with hormonal medications. So these are the women where we prefer hormonal medications, where the thickness, the inner lining of the uterus, the thickened endometrium can be dealt with. Hormonal medicines are usually estrogen progesterone combination pills. They are actually a contraceptive pill, but it is used in these scenarios to control the excessive bleeding. So it will be a cyclical hormonal pills. Usually will start from within first 3 days of periods, and they have to take it for 21 days every cycle, and then we'll reassess the thickness after 3 to 6 cycles of hormonal therapy. Meanwhile, we initiate lifestyle changes also in these women with PCOS. Like if suppose they are on the if their body weight is on the higher side, if they're obese, then a weight reduction, at least 10% of their existing weight would be beneficial to regularize their periods, as well as to prevent to control their heavy menstrual bleeding. And then these are the treatment options. So another group of women, like in the late 40s, if suppose they are suffering from this heavy menstrual bleeding, sometimes no, we call it as abnormal uterine bleeding. Sometimes we may not be able to identify a particular cause. Sometimes it is idiopathic. These women will first evaluate through a hysteroscopic guided endometrial biopsy, or a through office endometrial biopsy. Like the inner lining of the uterus will be sample from the inner lining of the uterus will be taken and sent for biopsy to rule out any other problems, like any underlying malignancies, cancers in the uterus, which could be also the reason behind this heavy menstrual bleeding. So this cancer is one of the cause. So first we'll rule out cancer and then we'll proceed with the treatment. So the treatment in this little advanced age group who are like not planning for pregnancy, apart from hysterectomy, that is uterus removal, we have a first line management called IUCD insertion, intrauterine device insertion, the hormonal IUCD. So this intrauterine devices where there will be a hormone impregnated in them. It is usually T-shaped device. We insert it after the biopsy result comes out to be non-cancerous. Then we insert after ensuring there is no cancer. Then only we do this intrauterine device insertion, where the hormone in this device will act upon only on the uterus, causing the inner lining of the uterus to thin out, so that thereby controlling the blood loss during periods. So this commonly used device name is Mirena. So this device, IUD, intrauterine device, once inserted can kept inside for 5 years. So usually approximately on an average of 3 to 6 months, the bleeding slowly comes down, and then some women can end up in complete absent periods because of the device being inside. So they can keep retain the device for 5 years, and then they can be relieved of the periods problem also. And then after 5 years, the device can be removed and reinserted based upon their age. For example, for a woman around 45 years, if we insert this intrauterine device, 5 years later she would be around 50 years. For in those women, a second insertion of IUD may not be required, because already 50 years is menopausal age group. So naturally, only periods will stop. So only one time insertion will be enough in this age group around 45 years. If the woman is much younger, like say around 40 years, then they may require twice insertion. Once in 5 years, two times will be inserting the IUD. So this is a very good option before going for a radical treatment like removal of the entire womb. This IUD can be tried in suitable scenarios. So we have some criteria where women, only if they fit into these criteria, we can consider this IUD. Especially if their uterus should, the cavity of the uterus should be regular, and there should not be any lumps in the inner part of the uterus. All of those. So if they have a suitable condition, then this can be tried, and these women can prevent having a major surgery like removal of the uterus done by opting for this IUD, or the Mirena insertion, to control their heavy menstrual bleeding. And hysterectomy is the final and last resort, where after trying the medical management and this IUD insertion, if everything is all the options are exhausted or they are not suitable for the women, then we decide for the final resort called hysterectomy, which is the removal of the womb. And again, based on the age as well, if women in the perimenopausal age group, hysterectomy is done. Nearing menopause, the removal of ovaries along with the womb can be performed after discussing with the woman what are the benefits and side effects of removing the ovaries. And in a much younger age group, we'll just remove the uterus alone and we won't remove the ovaries, because ovaries are essential for the hormonal support for women. So these are the things we usually discuss with the women before deciding about the surgery. And hysterectomy again can be performed through vaginal or abdominal, like through open surgery or through keyhole surgery as well, based on the individual condition. So these are the various treatment options for heavy menstrual bleeding. But the foremost important thing is prevention of anemia caused by this heavy menstrual bleeding, because most of the women neglect this heavy menstrual bleeding and then they suffer from symptoms related to anemia because of that. So my take-home message from this topic would be aware of what's happening with you, like especially the periods flow. If you feel it is prolonged more than 7 days, or you see some big chunks of tissue, that is only clots, blood clots. If you see the blood is not in the liquid state, it is passing as clots during periods, and you along with that you feel very exhausted, tired, and you're not able to do any routine activities, then this is the time, like, you have to consult your gynecologist and get it sorted out before you end up with any other major complications because of this problem. Okay. So thank you one and all for listening. If any queries, doubts, I'm happy to clear all of them. Thank you all.